Which of the following is the most sensitive method for detecting a small atrial septal defect or patent foraminovaly during echocardiography? A. M-mode imaging. B. Agitated saline bubble study with Valsalva maneuver. C. Continuous wave Doppler of the mitral valve. D. Measurement of the E/A ratio. Answer: B. Agitated saline bubble study with Valsalva maneuver. In a patient with an ostium secundum ASD, what is the most common supraventricular arrhythmia observed in long-term follow-up? A. Ventricular tachycardia. B. Atrial fibrillation or atrial flutter. C. Wolff-Parkinson-White syndrome. D. Junctional rhythm. Answer: B. Atrial fibrillation or atrial flutter, due to right atrial stretching. What is the classic finding on a chest X-ray specifically associated with a total anomalous pulmonary venous return, TAPVR, which can mimic or accompany ASD symptoms? A. Egg on a string appearance. B. Snowman or figure 8 sign. C. Boot-shaped heart. D. Water bottle heart. Answer: B. Snowman or figure 8 sign. A 35-year-old patient with a known ASD presents with a sudden onset stroke. No carotid stenosis is found. What is the most likely mechanism? A. Thrombus formation in the left ventricle. B. Paradoxical embolism via the ASD. C. Infective endocarditis of the aortic valve. D. Rupture of a baryaneurysm. Answer: B. Paradoxical embolism via the ASD. Which of the following is true regarding the closure of a sinus venosus ASD? A. It can easily be closed with a percutaneous Amplotzer device. B. It usually requires surgical repair due to its proximity to the SVC and pulmonary veins. C. It never requires closure as it is hemodynamically insignificant. D. It is located in the center of the interatrial septum. Answer: B. It usually requires surgical repair, to avoid obstructing pulmonary venous return. In the calculation of shunt severity using cardiac catheterization, what QP/QS ratio typically indicates a hemodynamically significant shunt requiring intervention? A. Greater than 1.0. B. Greater than 1.5. C. Less than 0.5. D. 1.0 to 1.2. Answer: B. Greater than 1.5. During physical examination, a mid-diastolic rumbling murmur at the left lower sternal border in a patient with a large ASD represents: A. Associated mitral stenosis. B. Functional tricuspid stenosis due to high flow across the valve. C. Pulmonary valve regurgitation. D. Aortic insufficiency. Answer: B. Functional tricuspid stenosis due to high flow across the valve. Which genetic mutation is frequently associated with familial ASD and heart block, NKX2-5? A. Fibrillin 1. B. TBX5. C. NKX2.5. D. GATA4. Answer: C. NKX2.5. In the setting of ASD, relative pulmonary stenosis refers to: A. An anatomical narrowing of the pulmonary artery. B. A systolic murmur caused by excessive blood flow through a normal pulmonary valve. C. Fibrosis of the pulmonary valve leaflets. D. Compression of the pulmonary artery by the aorta. Answer: B. A systolic murmur caused by excessive blood flow through a normal pulmonary valve. Why is antibiotic prophylaxis for infective endocarditis generally not recommended for an isolated, unrepaired secundum ASD? A. The defect is too large for bacteria to adhere. B. There is no high-pressure jet or significant turbulence across the defect. C. The right side of the heart is immune to infection. D. The defect is always covered by endothelial cells. Answer: B. There is no high-pressure jet or significant turbulence across the defect. Which type of ASD is located near the entry of the inferior vena cava, IVC, or superior vena cava, SVC? A. Ostium primum. B. Ostium secundum. C. Sinus venosus. D. Coronary sinus. Answer: C. Sinus venosus. What happens to the fixed split S2 when a patient with ASD develops severe Eisenmenger syndrome? A. The split becomes wider. B. The split may disappear or become a single loud S2, P2 becomes louder. C. The split becomes paradoxical. D. It remains unchanged. Answer, B. The split may disappear or become a single loud S2. Percutaneous device closure is most suitable for which type of ASD? A. Ostium primum. B. Sinus venosus. C. Ostium secundum with adequate tissue rims. D. Coronary sinus defect. Answer, C. Ostium secundum with adequate tissue rims. A cleft mitral valve is a common associated finding in which type of ASD? A. Secundum. B. Primum. C. Sinus venosus. D. PFO. Answer, B. Primum. Which of the following describes the coronary sinus ASD? A. A hole in the center of the septum. B. Absence of the wall between the coronary sinus and the left atrium. C. A defect near the superior vena cava. D. A persistent opening of the foramen ovale. Answer, B. Absence of the wall between the coronary sinus and the left atrium, also known as unroofed coronary sinus.